Welcome everyone to today's webinar, Change the Way You Engage Consumers in Their Health, Bring CRM to Healthcare. I'm Emily Rapley with Becker's Hospital Review. Before we get started today, I'd like to go over a few quick housekeeping notes. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We look forward to hearing your questions. Lastly, today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. With the shift to value-based care and a rise in consumer expectations, healthcare organizations are looking for insights and strategies to thrive in a changing industry. The objective of today's webinar is to provide actionable insight and next steps to those seeking to radically transform the consumer experience and, as a result, transform outcomes. We'll accomplish this by learning about how Christiana Care Health System partnered with Salesforce and Cerner to redesign consumer engagement, leveraging a clinically informed enterprise-wide CRM system designed for healthcare. At this time, it is now my pleasure to start today's webinar by introducing our presenters. First is Drew Fennell, Chief Communications and Experience Officer from Christiana Care Health System. As Chief Communications and Experience Officer, Drew leads communications strategy, end-to-end patient journey, and philanthropic efforts in alignment with Christiana Care Health System's strategic aims: optimal health, exceptional experience, and organizational vitality. Drew is responsible for ensuring patients are equipped with the necessary tools and knowledge to have an accurate understanding of their care journey, and also to promote a patient-centric culture that enables patients to have a positive relationship with their own health to create healthier and better informed communities. Drew joined Christiana Care in 2017 after serving as Chief of Staff to Delaware Governor Jack Markell. Before becoming Chief of Staff, she served as a Policy Director and Deputy Chief of Staff. Drew received her law degree from Rutgers School of Law in Camden, New Jersey, and her undergraduate degree from the University of Delaware in Newark. Drew, could you please share a little bit about your organization?
Sure, I'm happy to. Thank you for having me today. So for the last 130 years, Christiana Care has been delivering health to the people of Delaware and the surrounding region. We're a not-for-profit, non-sectarian, community-based, and academic health system. We're comprised of two large acute care hospitals, a freestanding emergency department, and a whole host of outpatient facilities, including surgery centers, medical aid units, primary care practices, and specialty care practices, as well as a robust home health care operation. We are the largest private employer in Delaware, and we have about 12,000 employees, and we call all of our employees caregivers, believing that everybody is just a touch or two away from a patient that we serve.
Thank you so much and welcome, Drew. Now I'd like to introduce David Bradshaw, who's the Senior Vice President of Employer and Consumer at Cerner. So David is a Senior Vice President at Cerner Corporation, leading the Consumer and Employer Solutions business units. He graduated college from Texas A&M, and he was then recruited into IBM. After 14 years in various sales and production management roles in the healthcare industry, David joined Memorial Hermann as the Chief Information Officer, a position that he was in for 19 and a half years. Then in 2004, in addition to the CIO role, David assumed the Chief Marketing Officer and Strategic Planning role. In 2015, David was promoted to Executive Vice President and Chief Strategy Officer for Memorial Hermann. Now in his current role at Cerner, David is focused on the digital transformation of the healthcare system, with an emphasis on consumer and employer engagement. So David, could you please tell us a little bit more about Cerner?
Yeah, sure will, Emily. Thanks. For 40 years, Cerner's really been focused at the intersection of healthcare and IT. 29,000 employees strong, world's largest publicly traded health IT company, with a set of associates with a mission to really relentlessly seek breakthrough innovations that shape the healthcare of tomorrow. It's in that place that we're using emerging technologies to engage individuals in their own health while arming our clinicians with data that empowers them to deliver smarter care faster. We support our clients by providing data-driven insights that enable them to make better decisions for health, both in a hospital setting as well as across the whole continuum. And it's for the last several years, we've been building our new age data insights platform. We call it Healthy Intent. That system is agnostic to data sources, meaning it works with any EMR, and it's from there that we really teamed up with Salesforce to leverage our data insights platform and the Salesforce platform to deliver value to Drew and her patients and her caregivers at ChristianaCare.
Thanks so much, David. And finally, I'd like to introduce Erin McGarry, who's the Vice President of Industry Partners at Salesforce. So Erin has been in leadership at Salesforce for 4 years, most recently leading Salesforce's strategic healthcare and life sciences partner business. Previously, Erin was Salesforce Regional Vice President of Business Development, focusing on new partnership initiatives, where he created the Salesforce Connector model, allowing partners like Cerner to bring meaningful data to the Salesforce platform. Prior to joining Salesforce, Erin was in executive leadership at VMware, managing their government cloud at HP, and managing their global systems. Erin, can you please tell us a little bit about Salesforce?
Thanks, Emily, and thanks for having me. Salesforce is the fastest growing enterprise company, a software company in history. We're proud to be named the Innovator of the Decade by Forbes. We've originated the software as a service model to deliver CRM 20 years ago and have been innovating with our customers ever since, which has empowered us to receive that award. We empower companies to harness data and deliver the connected experiences customers expect. We do this with our customer success platform. It's a single platform to intelligently connect and engage customers, in this case, patients or members. Healthcare and life sciences organizations have used Salesforce to reimagine acquisition, service, collaboration, and engagement to provide a better care team employee experience and a better patient member experience. They do this with the world's #1 CRM for healthcare, Health Cloud. Our goal here today is to share the technology and knowledge that we've gained over the past 20 years building the world's leading software as a service business so that together we can build the best possible solutions to our customers' challenges. Healthcare is one of the most challenged industries. This is where our partners like Cerner come in. Cerner brings a wealth of deep experience and data that when applied to the Salesforce platform, takes our best-in-class CRM to the next level.
Thanks so much, Erin, David, and Drew for joining us today. At this time, I'm pleased to turn the floor over to Drew to begin today's presentation.
Thanks so much, Emily. I feel like I'm not starting the presentation after the great remarks from both Dave and Erin about sort of why we're here today. But, as we consider new and innovative ways to provide value for the people we serve and the communities they live in, we are really always going to start with being exceptional today and even better tomorrow. And I'm going to tell you a little bit about where that phrase comes from. We have long rested on sort of our promise to our community, which is that we serve our neighbors as respectful, expert, caring partners in their health. And I think, as we consider CRM in particular, that really is about making that partnership real and really empowering the people we serve, our patients, to be effective partners in their own health. I think there's, a real change in the way healthcare is being delivered that does empower patients to be more active in their own care. So when we looked at this long-standing ChristianaCare way a few years ago, we created, out of that expression, we serve, we created a system of values and behaviors that we really think sets us apart a little bit from the others in the industry and really says who we are. And that is, we serve together, guided by our values of excellence and love. And when you saw that, we commit to being exceptional today and even better tomorrow, that's what really drives us toward innovation. But we really are looking always to stay grounded in love, because we know that when love leads, excellence is inevitable. And if we're going to create a truly robust and personalized communication system with our patients and our community, we need to remain really deeply grounded in those values, and that when we innovate, we really are most deeply engaged in both love and excellence. Our CEO, Dr. Janice Nevin, sort of said early on in the process of creating this document you're looking at, she wanted every single person in the organization to have participated in its creation, and we told her leadership that that's what she expected from us, and I think we delivered on that, and really came together with something, a cultural driver for us that really pushes us toward being super innovative. And we're talking today about CRM. But this is part of an entire sort of constellation of ways in which we're thinking about using technology to reach our patients. So we have a remarkable health and technology innovation center that creates sort of new products where there are gaps in the market to serve patients and caregivers with technology. We have an office of transformation that's bringing together all kinds of new technology and software into the process. One of the things we did that was really cool, and I say this as a cancer survivor, is we created a virtual reality experience for people in our infusion centers where they can sort of go to a place they love while they're being treated, and we find that it really enhances their experience and lowers their stress level. I think a lot about technology and knowledge of our patients as a way to really use technology to sort of surface empathy, right? This is sort of technologically driven empathy. And we figure out the things our patients need. A couple of other things that we do that I think are really critical in the innovation spaces. We have a gene editing institute located here in a community hospital, sort of a one-of-a-kind kind of arrangement where we can really bring bench to bedside research fully embedded in a community hospital. And of course, we've worked lots with Cerner on creating a great portal, and Cerner and our IT and clinical folks are great partners in that. So as we start to think more about CRM and how we can use that along with our clinical knowledge, we are really looking at CRM, which is a very traditional marketing tool. We're looking at it as more than just a marketing tool. We're really looking at CRM as a means to create patient engagement journeys that will eliminate gaps in preventive care, like breast cancer screenings or colorectal cancer screenings or other gaps in care that our clinicians identify as being priorities for them. And we work with Cerner and our clinical leaders, and we're led by our clinical leaders to identify and prioritize those gaps of care and address them. And then we work with Salesforce to drive up the participation of our patients, really in the old school marketing term, to drive up the conversion rate, to get people to really participate, to come in, to do the things that they need to do in order to drive forward their own good health outcome. And here's what we do know for sure, and we really deeply believe that addressing gaps in care is absolutely the right thing to do clinically, and we also believe that it's also the right thing to do from a business perspective, that these are good investments for us to make. Early prevention and intervention averts the need for more care later, and that's good for patients, it's good for caregivers, and we believe it's the key to our success as an organization. We're really in a changing landscape for healthcare payment, and as we move away from fee-for-service and toward risk-based payment models, we're going to be paid differently. But no matter what payment system we're under, getting really good at closing gaps in care is the right thing to do for so many reasons.
Drew, thank you so much for setting the stage there. I'd like to hear a little bit more now about the tech that is powering some of these innovations at Christiana Care. So, David, can you tell us about how Cerner and Salesforce are partnering with Christiana Care to make all this happen?
Yeah, sure thing, Emily. First, it kind of goes back to the relationship. Cerner, we made a strategic decision that we were going to partner with the world's largest, best CRM system instead of building it. And I think that was a core tenet of our leadership and our decision to do that. So you've got Cerner with its deep clinical expertise coming together with Salesforce and its tools of Health Cloud and Marketing Cloud. And really, we're putting these tools together and uniquely writing software. So we're actually writing software that sits between our Healthy Intent platform, our Millennium platform, as well as with Salesforce, so that we can drive these insights that Drew talked about. In this particular use case of preventive care gaps around colonoscopy or breast screening, those are insights that we make available, of course, in physician workflows and other places. But now we can send those over into Salesforce, where we can put the patient on a journey, if you will, and use the tools of Salesforce to engage that population. And we're excited that ChristianaCare is in the middle of doing this with us and helping our transformation. I want to just kind of go one slide deeper on some of the tech. And if you look at this architectural diagram, it really represents both the Cerner software as well as the Salesforce software, because on the far left represents that client's tenant of Healthy Intent. Roughly there's 174 clients within the Cerner base that use, and the non-Cerner base that use Healthy Intent. We manage some 227 million people's data in that Healthy Intent system, each uniquely segregated from each other. So ChristianaCare, they measure their lives in the hundreds of thousands. Data's come from the Cerner EMR and from other EMRs and from other claim sources, and it's been aggregated together, deduplicated, which those techies on the call will know that's a pretty hard thing to do in healthcare. And then we create this longitudinal record, which is a network-level view of the providers and the payers that contribute data to a unique person. And then once we have that longitudinal record, we can then apply insights to it, rules, registries, calculations. And so as the use case that Drew talked about, one of those key subsystems is our registry function. So numerator, denominator, ambulatory quality preventive care measures, colorectal, breast cancer, pneumococcal, HPV. I mean, the list goes on and on. I think there's some 70 or 80 different registries that we manage. But when you look at a population that's measured in the hundreds of thousands, and you're thinking about outreach for breast cancer or colorectal screening for the appropriate people that have not demonstrated that gap closure or that preventive test, it becomes a mind-boggling number of people to call on the phone or hope that they wander their way into one of your facilities. So what we've done is written software that transfers those insights over into Salesforce, and this part, which is the orange bar on the far right, and their stack of tools, and I'll let Aaron talk a little more about those tools. But there we can then put those tens of thousands of patients, or sometimes at some of our larger clients, hundreds of thousands of patients on what Salesforce calls as a journey, which is the ability then to engage that person under their preference, whether it may be a text or maybe it's a message, maybe it's a phone call if it has to be, but a method to engage them into owning, their own health status. It's funny, a patient is probably the single most motivated person about the healthcare outcome, but oftentimes they're the least informed and the least motivated. And so the partnership of Cerner and Salesforce is really trying to close that gap. And if you look at some of the early creative, now we haven't used this. This is Drew and her team, finally, will sign off on the look and feel. But what you start to see is a multimodality campaign, so that Drew and team build the collateral, the hard collateral, as well as the digital soft collateral that really elevates the preventive care measures across her whole community. And at the end of the day, being in that community for 100 plus years, they really are about supporting the health of their community. Now, some of those lives we know will be at risk, and they'll have, Medicare Advantage lives and quality lives. And of course, we've got to hit all of those underlying numbers. But at the end of the day, it really is about increasing loyalty and engagement and driving better patient outcomes at a lower cost. So Emily, that's a little bit of the deep tech, and I'll turn it back to you.
Thanks so much, David. I really appreciate that breakdown there. So I'd like to turn to Aaron now to dive just a little bit deeper into the tools that create that connected consumer experience. So Aaron, can you talk to us a little bit more about how CRM technology plays a role in creating that connected consumer experience?
I'd be happy to, and I'd like to build on what David just walked us through. So the challenge for many providers is that healthcare consumer interactions are spread across multiple siloed systems. You can't manage that total experience if you can't see the total experience. So, for example, what you see at the bottom of the screen labeled systems of record are typically siloed systems. Our technology allows us to centralize that data. We can make meaning out of it. We can provide it to the right user at the right time being each consumer's interaction points. And you see this as we move up the screen. Using a CRM allows us to do this at scale. And we have to do this at scale because each patient we interact with in the system has the expectation that we know and understand them. We as consumers expect that because consumer companies have been providing it to us for years. Provider organizations have some of the most intimate details about us and our lives, and we want to feel known by us or known by them. We want our healthcare experience to be like that of TurboTax, Hulu, Marriott, a multitude of consumer companies. Those companies are connecting experiences today using Salesforce, and they're meeting the customers where they are in their life cycle.
Thanks so much, Aaron. So I'd like to turn to Drew now just to hear a little bit about how you've overcome some of the challenges that come along with creating that connected consumer experience and how CRM is going to help tackle that.
So, I think Aaron did a great job of sort of identifying, honestly, some of the barriers. If you look at the slide that he just put up, that's a lot of information coming from a lot of different spaces. And I think one of the things that we're really looking at as a challenge is how to leverage our understanding of clinical pathways, for example, in ways that really do serve our patients best. We're looking for new ways to engage people as partners in their own health, and we're working toward being able to have this 360-degree view. Imagine how much better and more consistent an experience it is for a patient if they are being contacted in ways and at times, and they're being brought along on a journey that's been designed to engage them as the driver of their own health. And I think we have a huge opportunity really to look at how we can move across those silos in the organization, bring in all of this data from all of these different kinds of sources, and look at ways that we can, again, personalize our contacts with our patients in ways that help them understand next steps to take. And as David brought up, sort of that idea of helping to fuel their motivation, but also to remove friction and barriers for them to receive the care that they need, and the care that we hope we will help them want, and to connect them with the caregivers, so the caregivers, their clinical caregivers also have this 360-degree view of how they're managing those gaps in care. Because there are lots of ways to approach a patient who's in need of preventive care. And this allows us to really understand who needs what kind of communication or touch when in that journey. And I'm really excited about the potential for raising our engagement with our patients around these incredibly essential elements of their care.
Thank you, Drew. And as a quick follow-up here, how will you measure the success of those initiatives?
So, ultimately, I think we're going to measure our success on outcomes, right? We're really, one of the things I think that's interesting about this particular project is we'll have interim measures where we'll be looking at, all of the traditional kinds of open rates and engagement rates and, did people call, did they do this? But I think one of the things that's really amazing about our ability to really partner with our clinical leaders and to really serve their needs as well, is that, one hopes that as we move through time, we're able to actually look at the fulfilling those gaps in care or other kinds of clinical needs, that we'll actually see better health outcomes. I mean, because that's what we're here for. I mean, we're here to eliminate, reduce human suffering. We're here to make people well. We think of ourselves, we talk about ourselves as, we're a healthcare system, but really our job is to deliver health, not just health care. And so I think this is a remarkable opportunity for us to begin to understand where and how we can create positive outcomes for individual patients and for whole populations as we walk toward this risk-based environment. We have to keep, the incentives are perfectly aligned in that environment for taking the right clinical action, for taking the right, process action, for people like me who are in the communications business, but to have all of that be directed toward keeping people well. And I think that's ultimately where we want to go. I think that, the paths of sort of CRM and how we measure whether a particular journey is working or not, A/B testing and all of those good things, that's a pretty well-trodden path. And I think we would be using many of those same kinds of measures to see how we're doing on the engagement. I think ultimately for us, it's going to be about whether we were actually able to deliver better health outcomes for our patients.
Absolutely. Yeah, it's fantastic to see that it can directly relate to that end goal of creating health and positive outcomes for the patient population.
Yeah, it's a really exciting place to be, in healthcare and in healthcare communication and marketing, to really to bring to some fruition this idea that we are in fact all caregivers, and that everyone who works here in our health system has a role in delivering health to the communities that we serve, and making those things real for people and helping them live their best lives.
Absolutely. Thank you so much, Drew. So I'd like to turn to David here for a second. I think this is a question a lot of organizations listening in today might have. So for organizations who are looking to invest in CRM, how does it tie into other consumer engagement technologies, such as the patient portal or virtual health capabilities?
Yeah, Emily, that's a good question. And, I've been at Cerner now 6 months, and I actually have both of those executives that report to me, our Healthy CRM work as well as our Healthy Life work. And I think that this graphic, while specific to Cerner, is also generic in our industry. It's not an either or, it's a both. And let me build on that for a moment. So on the far left, you see this longitudinal record. That's that curated data set that we talked about a couple of slides ago. Some places measures hundreds of thousands of people, other places millions of people. And there's a whole set of blue box business objectives there: gaps in care, condition management episodes, provider network, keepage, leakage, all kinds of business rules around that. But if you've ever broken open the code and really looked at what the logic would be around a registry. Let's just take a simple diabetic. What really constitutes a diabetic? And what constitutes a hemoglobin in control or a foot exam performed? That's a very deep clinical set of rules. And I've actually seen marketing departments try to mimic that themselves. And we're saying, marketing, don't do that. Use the insight from the clinical team, because that's what they're driving into the physician's experience, and let's reuse that insight into both into Salesforce as well as into the new age patient engagement platform that at Cerner we'll call Healthy Life framework. So let me build on that for a moment. So Drew talked about preventive care gaps of colorectal and breast mammography screening. So numerator, denominator managed in the Healthy Intent system, those insights into Salesforce. Those same insights should be going into our patient portal applications. That patient should be able to see that insight and activate. We call that at Cerner the longitudinal plan, where those type of insights land. But Salesforce will take those insights, engage into the thousands of people, let's say, and what is typically the call to action? Schedule a visit. And we really want to use the technology that's in our transactional consumer systems to self-schedule as opposed to calling me on the call center. So Salesforce and Cerner share a common partner, Kyrus, out of Boston, Kyrus, where they have built a provider directory. They built a self-scheduling system. They'll work in the Salesforce Lightning component of a health cloud, but they also work inside of our Healthy Life framework to enable that patient to get the insight through the journey and then go into that patient application where they're known and schedule their visit. And I think that we're going to see these two systems, really these systems being CRM and the new age patient engagement platform. I hate to call it a portal because that has such a meaningful use connotation. But these two things will work together to really build that engagement platform.
Thanks so much, David. I'd love to just hear from Drew here because you've been through this before. Do you have any actionable advice you can share with our listeners from healthcare organizations who are looking to enhance their consumer engagement strategies using CRM technology?
So I think, thinking of a marketing department as your partner. I mean, David made sort of a good example of, sometimes the folks who are doing the outreach, the outbound kind of marketing efforts are, a little outside the clinical environment, as we should be in many circumstances. But I think the ability to refine for people who are our patients, the ability to really reach them in ways that are helpful. I think this idea of breaking down the silo between our communications teams and our clinical providers is really an exciting place to be. And I think my advice would be, seek that partnership. You have a remarkable opportunity to bridge your marketing and communications team, IT. Our IT partners are amazing. The people in the organization that are going after new technology and new applications like Kyrus, and we have a team that works closely with that group as well. And to look for ways in which you can really think about using these sort of classic, as I said, well-trodden, well-understood ways of reaching people, but to really apply them in new ways that are really about helping people be good partners in their own healthcare.
Absolutely. So really making use of a lot of tools that are already in existence for organizations.
I think that's right. And I think, one of the things that's really interesting to me is, as we think about breaking down those silos is, and one of the things I think technology now makes possible for us is that we can have the benefit of that knowledge without having to be the operator of the system. So if that makes any sense, it's not my marketing department's job to make appointments or use Kyrus, for example, or any of those things to make appointments or to run medical practices, right? But our ability now to understand what is happening in those practices, to work closely with our medical group to understand how they're prioritizing their own work and how we can support that in ways that are really based on data rather than just sort of good kind of rules of thumb about how we might be able to do a better job for them. But to really be together in this space in which we're really looking at being able to reach large numbers of people in a very efficient way and drive them down a journey, a path that really gets the outcomes that we're hoping for. Sort of David and I, had a conversation a while ago because he was in marketing and IT, right? Which was that the marketing tools that we're bringing to bear, the expertise that Salesforce brings, exists in lots of places that all of us touch every day. How do we bring those tools into a place where the actions we're trying to influence are actions for positive healthcare behavior? It's not just about driving someone to buy your thing or pick up the phone and call you instead of someone else. It's really about informing people and making them, again, good partners in their own health, driving up their motivation to participate, and figuring out for any specific person or group of people, what is it that we can do, that my team can do to support the clinical enterprise in making people want to engage, make it easy for them to engage in their own healthcare. And I think that's a new place, I think, for all of us to be in healthcare.
Drew, thank you so much. That's great advice. Erin, I'd love to tap you here and just see if you have any additional advice you'd like to add to Drew's.
Absolutely. I think Drew hit the nail on the head. You want to get people engaged in their healthcare journey so they can be more proactive and engage more with you at the right time, right? So I would challenge everyone to think about the front door. What are all the ways a patient or member finds you? How are they interacting with you or accessing your systems? Do you have a strategy for your front door, right, to capture all of that? Think about the companies to which you're most loyal in your day-to-day activities, right, whether they're consumer brands or whatever it may be. Why are you loyal to those brands? I would recommend that as a team, you guys study how those organizations interact with you, what they know about you, how they preempt your needs. They're doing all this today with a CRM, and you can do it as well. So I would challenge you to think about that and have a good strategy for how customers are interacting with you.
Excellent. Thank you so much, Erin. This looks like a great time for us to pause and take some questions from our audience. So just as a quick reminder before we get going on our audience Q&A, you can submit any questions that you have by typing them into that Q&A box that you see on your screen, and we'll try to get through as many questions as we have time for today. So to get started, I think this first one is a great question here for Drew. Drew, can you tell us, how are you thinking about governance of CRM across the organization? So who manages the campaigns and who's accountable for execution and success?
So I think, we're really going to have to figure out for ourselves in a new world what a new governance model really looks like, and how we can truly break down those silos in ways that allow each part of the organization. I mean, we're in silos for a reason sometimes, right? Because we have real expertise inside those silos, directed toward real outcomes for the people who are doing that work. But how do we sort of break down the silos of inbound and outbound communication as they're seen through the eyes of the patient, right? So that the patient is getting a consistent experience and a consistent way of engaging with us and for us to engage with them. And really creating some shared decision-making across those silos about things like what do we prioritize, how do we build logic systems, for example, as we become more and more sophisticated and better at doing things like, real-time surveying, patient reminders, the kinds of journeys we're talking about here in terms of creating a specific journey toward a particular health behavior. How do we, for example, look at individuals? How will we together decide on the prioritization rules about which kinds of communications our patients and our community should receive when? Because this particular journey we just laid out here exists in a larger ecosystem of care for the people that we serve, and we want to be sure we're doing it in ways that really do reach them where they live and with what they are doing. So I think figuring out how to do this kind of shared governance, I think, is going to be really a fascinating process, and I think one that has the potential to really make all of us, each of us, better at what we do inside our own area of expertise. I think there's an organizational level accountability, and as we, like other organizations, are sort of walking straight toward risk, upside and downside risk, I think there's organizational accountability for this kind of patient engagement. David used the word loyalty a few minutes ago. That is going to be really important as we begin to think about what does patient engagement look like. How will we know when we've gotten to a place with a patient where they really do feel empowered and knowledgeable, and how will we do that at the granular level so that we're reaching them in the way they prefer. We're keeping track of what they like, what they don't like, that we're figuring out ways to really serve them in the ways they want to be served. Because ultimately, when we think about value, we're only providing value if our patients are getting the outcomes that they want, that they're living the lives they want to live. So really being deeply respectful of that patient and the patient journey, but also being respectful of each other and of the various kinds of expertise we bring in, and how do we each, within our own domain, remain accountable for our part of the process while still keeping our eyes on the system accountability for, not only for all of the traditional measures, but as we walk toward risk, toward really, having to understand that our success as an organization relies on being able to keep people healthy. I think that's a remarkable opportunity for us.
Absolutely. Thank you so much, Drew. So we do have a ton of great questions coming in from the audience here. This next one I think is great for Erin. Erin, what do you think healthcare can learn most from other industries as it relates to CRM and engagement?
Great question. So at Salesforce, we work across all industries, including other highly regulated industries like financial services, as an example. I think these other industries have a lot of applicability to healthcare. I mean, financial services is now orchestrating complete customer journeys to the point that they're able to anticipate a customer's need and then provide the right service and resources at the right time. And we see other companies, especially in FinServe, internalizing two key principles. First, better engagement equals better outcomes. That's kind of the golden rule. Banks, like hospitals, are keepers of some of our most important information, and they often interact with us during very stressful times, whether you're getting a loan or you're going in for shoulder surgery. TD Ameritrade, Bank of America, and many others have shifted service operations to Salesforce for call centers and social customer service like Facebook and Twitter. The second key principle I would say is meet the customers where they are. You may recall a few years ago, there's a Super Bowl commercial where TurboTax had a customer on the commercial pressing a big SOS button to get live help via video conference. That was Salesforce in use, actually, to meet the customer where they are. Other industries have been pretty quick to pivot to new digital channels. And the best ones are embracing a complete omni-channel experience, right? They're engaging their customers on all the channels where their customers live natively. And, a millennial that may be chat, Gen X that may prefer web, baby boomers might prefer phone, but we can meet them where they're at. I personally have kind of gone through this journey recently. I'm right now recovering from shoulder surgery, only a couple weeks out, and I had to navigate through my own experience. And when I compare it back, I would say if I called Wells Fargo to spin up a mortgage, and I'm a Wells Fargo customer, and they weren't able to pull my Wells Fargo banking information, I'd be stunned, right? That's how I felt my experience was, and I think that happens in healthcare all the time. Why do I feel like I'm a new patient when I'm on a different floor of a hospital, or I meet a new specialist for my recovery program? I mean, my entire experience from being diagnosed with having an issue, I had to have a slap repair on my posterior and anterior labrum. From that moment that diagnosis was done, all the way through surgery, through my physical therapy to get me back to 100%, all of that should have been choreographed, and my provider should have understood who I am, and I should have felt known and guided through that process, and I just simply didn't. I wish that I would have been working with Christiana and Cerner at the time, because it would have helped me through a guided journey, and they would have understood kind of where I'm at in my process and how I'm doing. And for me, I just had to figure out the entire thing, and I'm in the industry. I empathize with people who are not.
Absolutely. That's really amazing, just comparing, your healthcare experience to what you experience in other industries, and really puts that into perspective. Excellent. So our next question here is about patient financial responsibility. So we have an audience member who asks, does this solution include the financial components of the patient experience? So, for example, informing patients how much they will owe or how much they do owe. And I'd love to send this one over to David.
Okay, good one. Does the solution include financial components of the patient experience, how much they owe or current balances, I would imagine? I think out of the box the answer to that is no, but I think that's the landscape that Aaron just described that we have to build towards. And let me give you a perspective. I think we're in I'll call it the third wave of consumer engagement. I think the first wave was really when meaningful use came and we all drove patient portals, and IT mostly drove those projects. I think the second wave was usually departmentally driven, marketing, digital innovation officer, and it was kind of an app for that. And there was this proliferation of apps. Self-scheduling was a big one, balance after insurance, and I'll tie the balance after insurance self-payment here in a minute. I think we're in this third wave starting right now about integrating these various technologies together to truly build brand loyalty. And we all know there's enough competitors out there these days for our local systems, and it really is about the 360-degree view. So let me give you this example. While we're not doing it now at ChristianaCare, not that we couldn't, but as the call centers come on to Salesforce's Health Cloud, there's no reason that we aren't bringing the balance after insurance from the self-pay app. In our case, that's SimplyPay that we work with and partner, bringing that balance forward onto the screen for that call center agent, and it's the same data that's going to the patient over the patient portal. And I think that's an example of how we build these integrated systems. The other part of the work that we've done with Salesforce is all of the preventive care insights that we described earlier. We can make those available to a call center agent using Health Cloud. And should it be scripted? Should it be within the domain of the privacy officer? There's a lot of ifs around that. We could put heads up to the call center agent that, let's just use my wife as an example, that Jennifer hasn't had her mammogram and that she's calling to make an appointment for our son, but the call center agent could intercept that and have a discussion about that preventive care guideline, that the data is that real time. And I think that's a great example of the integration that we have to build in our industry.
Absolutely. Thank you so much, David.
And I think David, this is Drew. I just want to pipe in on that a little bit too, because I think, David's mention of, making sure that we've brought in the privacy officer, that we've involved. I think that's part, when we talk about those silos, I think that's really an important part, a critical part of this process. And I know that matters a lot to us as an organization, and we're going to be moving sort of very deliberately as we move from element to element. The use case we're involved in right now is one that's pretty classic. Let's do a preventive care. But as we move forward, they're going to be, what David described as more complex, for real, right? So how will we do that and make sure that we're maintaining, fidelity to our own values around respecting our patients and always putting their privacy and information security first, right, as we open these processes. And, I think we've got great partners in that, but that is, I talked a lot about the clinical enterprise, and I talked some about IT, but I think we did not touch perhaps as heavily as we might have on this idea of making sure that we're staying true to our word on how we keep patient information, how we steward that in ways that are careful and responsible.
Absolutely. Thanks so much for adding in there, Drew. I think that was really helpful. I'm going to send it right back your way here to talk a little bit about buy-in. So we have an audience member who is working on trying to convince their leaders. Can you share a little bit about what you presented for ROI?
So interestingly, we are in a process of looking at, for us, the ROI is around the kind of work we're talking about in terms of risk. And for us, in these early stages, I think we want to look at, The use case we have right now is one in which it's really actually, and David or Aaron jump in here, the use case we have now is sort of a classic ROI, right? If you're in a fee-for-service world, the ROI is around, how many procedures did we measure? A little sort of old school, way of looking at it. If we look at a risk world, we're looking at those gaps in care measures, which can be tied to, how we drive revenue. And if we're in a full upside and downside risk world, we're looking at ROI, where I think this is where we're on a learning journey, right? How do we actually tie these kinds of activities to health outcomes, and how do we do that in partnership with the people who are running, our population health projects, and how do we do that in ways that really support them in their work? But that's I hope that answers the question. But that's really sort of in these use cases. We're sort of able to do this on sort of a couple of different ROI measures. One we know well, and at the one end, and at the other end, one that we're really learning how to measure ROI in that environment.
Absolutely. Thanks so much for sharing that. So this next question I think is a great one for David. So we have an audience member who asks for you to talk a little bit more about the biggest challenges you see in integrating the two platforms. So technical, procedural, regulatory, whatever challenges.
No, and the platforms in this case, I take it being Healthy Intent to Salesforce. So,
yes.
I've got a set of truisms, and one of them is things always take longer than you think they will. And I think this was the case as we set out to write this software between Healthy Intent and Health Cloud. A couple of the aspects of that is you've got two systems with underlying data models. So while I wish we all agreed on one universal data model in healthcare, we don't. Salesforce had their things, we had our things, so there was a lot of crosswalking and pollinating the data and making sure that we get it in the right place at the right time. You've also got to solve for the issues that a lot of our clients already have a Salesforce, and so they may have Mrs. Jones already in the system, and do you pin this data to it? Do you create a new Mrs. Jones? So the work around that was a very key piece of software that we had to write. On a privacy and security standpoint, it's really about the profile and security model of how we limit access to the minimum necessary needed, and that has to apply both in the Salesforce world as well as in the Healthy Intent world. You've got a whole set of logging that you have to create as to who looked at what, and you got to be able to produce that for your privacy officer. And then I think the third dimension of this is just simply data volume. I think most of our CRMs in healthcare, and this is a pretty overgeneralization, but have been driven out of small data sets. I think we see Salesforce running some of the largest companies in the world in other industries, but in healthcare we still are dealing with relatively small data sets. When we connect a Healthy Intent system that's bringing hundreds of thousands or millions of records, just the throughput, the ability to restore the deltas, what happens at night, what happens when a data change, how do we update Salesforce to that change? Because we keep these systems almost in real time synchronized with each other. And, we've seen some pretty advanced clients that have been out there trying to write some of this on their own. And, it's an interesting dialogue. Do you really want to be in that business, or do you want to license a connector and just have the data flow and you manage it through a series of configurators? Because, the average person in our database often is on 5 different registries and has 9 different gaps of care. And if they're in an active care situation, the frequency of that data changes relatively quickly.
Thanks so much, David. And it looks like we have time for just one more question here. So this last one is a great one for Aaron. Aaron, can you tell us, is Salesforce exclusively tied to Cerner, or is Salesforce able to work with Epic and other EMRs?
Great question, a nice follow-on to the one that David just went through. So Salesforce is a system of record, and we're agnostic to the data sources that come into it, right? Meaning you can integrate anything into the platform. We have an open ecosystem that allows our customers to pull in all those traditionally siloed data sources. And as you can imagine, we work across a lot of industries, so those data sources vary wildly. But I think this is where a huge benefit of Cerner comes in, is they've really done the heavy lift already, right? They've already made the integration from Cerner into Salesforce. It's done as a connector. They've thought through along with us how to make that best work real time and make sure it fits the needs of the healthcare industry. So it's a huge value out of Cerner's. They've already done that. But at the end of the day, if you have a bunch of disparate siloed data sources that you need to integrate in, we're agnostic across the board on bringing those into the system.
Awesome. Thank you so much for clarifying that, Aaron. So that concludes our presentation for today. I want to just give a quick thank you to Drew, David, and Aaron. That was an excellent presentation. As well as Cerner and Salesforce, thanks so much for sponsoring today. And then to our audience, on behalf of Becker's, thanks so much for joining us, and we hope to have you at future webinars.